The Local Show, featuring conversations with business owners, employees, and local business leaders about their successes, challenges, and reasons for doing business. Right here in Central New York. The Local Show is locally produced by Zoe Advertising. Now your hosts, Tom and Steve.
We'll continue our conversation with Dr. Marc Pietropaoli. Marc, my uncle came up to see you, Uncle Gary, and unfortunately on that side of the family, on the Murator side of the family, there's a lot of the rheumatoid arthritis and all that. So he has had one hip replacement, and he's looking at another one, and his rotator cuffs are shot to all high heaven. So he came up and saw Jordan, I believe?
Yeah, Jordan, our physician associate, yes.
Yeah, and he went through a whole, he said it didn't take really long. It was maybe a couple hours.
Well, usually it's about, Jordan probably we usually spend about an hour with people, just getting to know them, getting their whole story, figuring out what their goals are. And then we'll do a fresh set of x-rays. So he had x-rays of his, new x-rays of his hip, his shoulders, and then MRIs, not just to look for the rotator cuff or the soft tissues, the cartilage, the tendons, the ligaments, the muscles, things like that. But what a lot of people neglect is if there's these soft spots or these little stress or microfractures in the bone, that can give you pain. You can only see those on an MRI. So we get MRIs. And then he also had an hour evaluation with our total body fitness people, our VFit people. I think he saw Zach, if I recall. And so they really figure out, is it just the hip? Is it just the shoulders? Is the neck involved, the back involved? What other areas, and what can we do to take the pressure off those areas? And they will give us recommendation. We'll meet as a team. We'll all talk. Jordan did ultrasounds on him as well, so you can see the rotator cuff moving, you can see the hip moving, you can see the knee moving. And then after all that, he's going to come back in, and Jordan's going to go over all that with him, spend probably another hour and a half with him, which good luck with that anyplace else, right?
Right.
I mean, the average time that a doctor spends with a patient is 7 minutes in the U.S. But anyway, then they'll go over kind of maybe three personalized plans for Gary, and he can kind of choose what he wants to do. And the cool thing about orthopedics, getting back to that, is that it's most of the time it's not an emergency, it's not life-threatening or limb-threatening, so he can always say, I don't want to do anything, that's up to him. But most people who come to see us, they're to the point they want to have something done, and most of them don't want to have surgery and don't want to have a knee replacement or a hip replacement or things like that, because it's a lot bigger surgery.
And is this usually a second opinion with you? I mean, have they gone through something and maybe like Tom's uncle was, or is this like they wake up and go, I'm going to go see Dr. P?
You know what? That is a great question, and I'd say it's probably 1/3, 1/3, 1/3. So 1/3 of people probably don't know us. They're coming to us for the first time, and a lot of those people have seen other people, but some haven't.
Right.
And then you also have we have 30,500 patients that we've accumulated over the last 26 years or so. So we still get a lot of patients that are loyal to us and been with us for a long time, and they call and they already know us, so they call and ask to see us again.
Okay.
I think that it's becoming more popularized, what you're doing, and some people will call it regenerative medicine. Explain a little bit about what happens to avoid a surgery and what you do to avoid that.
Yeah, so regenerative medicine it's kind of a generic term, but basically our bodies, every day we kind of beat our bodies up. I'm just going to simplify things, but we get little microscopic cracks and breaks and things like that. Then we go to bed at night and our bodies repair ourselves. As we get older, that repair isn't as good or as effective as it used to be. But we have ways of taking the substances in our blood or in our cells in our bone that are the repair cells or the repair substances, and we're able to concentrate those and inject them into areas where you need some specialized help with healing. And that's kind of how it works. So if somebody has a plantar fasciitis, for instance, like you were talking about, itis means inflammation. So the arch of your foot is inflamed. Well, you can inject a cortisone shot in there, which is the, quote, traditional way of doing it from like the 1900s. But that weakens the tissue. It does decrease inflammation, but it weakens the tissue, and you may end up tearing that. Whereas we can just take substances from your blood, your platelets, spin them down. We can concentrate them. They have growth factors like fertilizer, and then using an ultrasound, we numb you up, by the way, inject it into the area where that inflammation is, and it can make the inflammation go down like the cortisone, but it can also help with healing, which cortisone doesn't do.
So you're actually regrowing tendon or regrowing muscle?
You can do that, especially with muscle. Tendon has a little bit less of a blood supply, and so does cartilage. So the less blood supply, the less chance of healing. But on the other hand, that's what we're trying to do, is we're trying to get your own body to heal itself. And normally it wouldn't be able to heal itself because you don't have very good blood supply to that area. That's where laser comes in handy too. No needles, no shots, no known side effects, very, very safe. And the laser can increase blood flow, decrease inflammation. It can also help relieve your pain. So these are all things that are not covered by insurance for some reason, because they work.
Yeah, exactly.
We're all fans of the insurance company.
I also think it's because they can't regulate. How can we regulate your platelets or regulate your own tissues? So that, I don't know if that's the problem why they won't cover it, but there's at least just talking about PRP, there's not even talking about cell therapy and all these other things.
Stand for?
PRP stands for platelet-rich plasma. So that's where we take the blood, spin it down, get the platelets, and like I said, they have growth factors injected. And there's about 37 studies, level 1, high level 1 or level 2 studies, high level studies, randomized studies that show that PRP works better than cortisone, gel injections, physical therapy, certain types of physical therapy, and even arthroscopic surgery for knee arthritis.
Wow. Now, how about stem cells? We can't get stem cells like off the shelf, but we can use people's stem cells.
Well, we can get stem cells off the shelf in other areas of the world. So I do have access to a place called the GARM Clinic, which is down in an island called Roatan in the Caribbean, and also there's a place in the Bahamas that they're going to be opening up. But yes, in the U.S., we cannot get stem cells off the shelf. So we use your own, and your body still has really good stem cells, especially in the pelvis area, even into your 80s. So we can do a very minor procedure, numb it up, local anesthetic, no general anesthesia, harvest your cells, concentrate them, and inject them into areas where the problem is. And the cells, I think, work better because the cells do the work. The PRP is just growth factor or fertilizer, whereas the cells actually are like the grass seed or the seed for your garden.
Should the placenta be saved?
So the cells that are harvested that we have available at the GARM Clinic are harvested from placenta or umbilical cord, which is going to be thrown out anyway. And also these people are screened. And
what about someone saving their child's blood? What about
that? Well, there is a way to do that, and we've done that with 2 out of 3 of our kids because I don't think it was available for the first one. But you can save. I forgot the name of the company, but yes, you can save
placenta.com.
You can save cord cells. If they take the cord cells and save them. For your children. Right now, we don't have any way of taking those and using them to inject in your knee and things like that. That's not really allowed either right now, but maybe down the road. But yes, in case there's a blood cancer or something like that, they will have their cells, their stem cells saved.
So real quick, joint pain, yes, you are a surgeon that now doesn't do surgery, but is into having folks' knees and other parts of the body restored without surgery. That's your happy place.
That's true. And I think that first part of the show that we did with the origin story starting out, we were talking about fishing and it got into how I got into it. I think that's a good story to tell, is how someone who did a lot of knee replacements now doesn't do them.
Right.
And we can always talk about that down the road.
And we will. So victoryinmotion.com. Maybe you need a second opinion. Maybe your knees hurt or your joints hurt. At least have a conversation.
Sure.
Or you can call 685-7544. And how about that? What if you didn't need your knee replaced and you could fix it? That would be cool. Thanks for joining us today.
Cool. Yes, thank you very much.